Hi, Dr. Val here. Happy Sunday and welcome to another mini webinar. Today I'll be talking all about pills and potions for sleep. And if you didn't know, I co-edited a book all about integrative sleep medicine that is available on Amazon. There's my name there. And chapter 15, the author is David Kiefer, and he wrote a really excellent review on dietary and herbal supplements for sleep. So I'll just be quickly summarizing some of the information that he provided and bringing in some anecdotal stories from people that I talk to or patients that I've seen in my practice. So without much further ado, this is a video all about pills and potions for sleep. So let's get started. Probably the number one supplement that patients ask me about is melatonin. And melatonin, probably deserves its own video to itself, which I'll probably do in the future. But really, what I want to talk about melatonin is in the fact that it can help. And in medicine, the answer is always it depends. So when we take a look at what sleep is broken down into four stages: stage one, stage two, stage three, and stage REM or REM stage of sleep. And depending on how long you sleep, you have 4 to 6 cycles of this during the night. Melatonin is actually a natural hormone released in the pineal gland, which is deep inside your brain near the hypothalamus, in response to darkness. And melatonin, it's really interesting because there's more than it does than helps regulate our sleep. It may have some anti-inflammatory properties, some anti-cancer properties. There's a lot of talk about how it can actually affect our gut, and we have a lot of melatonin in our GI system, which is pretty interesting. But in terms of sleep, does it help you fall asleep? It may, right? And also, there can be a strong placebo effect. Placebo effect can be up to 30%. Placebos, if you want something to have a positive effect, it can. But really, what melatonin does, it helps regulate our stages of sleep. So as the night goes along, we have this other part of our sleep system called the homeostatic sleep drive. And the longer we're awake, the sleepier we get. And the more we sleep, the less sleepier we get. And so there's this great picture that I like to show my patients. And as the homeostatic sleep drive starts to lighten, as we sleep throughout the night, melatonin actually starts to peak. Yeah, so it can be really helpful for people who have circadian rhythm issues. So maybe some jet lag or potential some delayed sleep phase syndrome, people who are night owls. And also there's some people who can benefit if you're a little bit in the older range, 55 to 60 and above. There's said to be decreased release of melatonin from the pineal gland. But for everybody and for kids, I would really caution with that. And the other thing too is that there was a pretty big study in 2017 where they analyzed, I think it was like 30 different melatonin brands. And since melatonin isn't a regulated medication substance, it's sort of regulated more like a food, it may not even have the amount of melatonin it says on the bottle. And so there's some quality standard concerns regarding it. Yeah. And there are also side effects from melatonin. Some include things like headache. I know some patients have told me after taking melatonin, they have more vivid dreams, and it can even lower your blood pressure. So if those are something that you're concerned about, as a disclaimer, even though I'm a medical doctor, this is not medical advice. Talk to your physician about any health concerns that you may have. So melatonin, plus minus, it may work if you are a shift worker or jet lagged. Oftentimes I see melatonin, it is sold mixed with other substances that may be more sleep promoting. Why? Because other substances may work on the GABA system. The GABA system or GABAergic medications or supplements can actually help induce sleep. Why? Because it helps slow down the brain waves, right? And so, what are those other substances? Well, magnesium. Magnesium is really good. It's also really great for helping relax the muscles. For my patients who have restless leg syndrome, we recommend maybe taking a magnesium supplement or taking a bath with magnesium. There's also magnesium oils. Valerian root is really popular as well. It's been around for a long, long time. Has some anti-anxiety effects, some sedative effects, and yeah, it does also work on GABA. And here the author writes that valerian may act as a serotonin and adenosine agonist, right? And so those are things that really can help support the sleep. Yeah. So it's really phenomenal how there's things found in nature that can mimic our natural sleep rhythms to help us improve your sleep. Sometimes the studies are mixed, though, in terms of will these substances actually help. Um, According to Dr. Kiefer here, a meta analysis, so taking a look at 5 clinical trials, it only found that one showed a little bit of significance of improvement in helping someone fall asleep faster. And then none of the studies actually found a difference in sleep duration. Sort of anecdotally, I definitely have heard of patients who have taken valerian root. One caution is that sometimes people say it smells like stinky feet. So if you're going to take it, probably more pleasing to take it in a pill form, a supplement form, rather than a tea. Sometimes it's also combined with hops, and that may help as well. Valerian root, hops, passion flower, chamomile, those blends may help promote falling asleep faster, may help you feel drowsy because it works on the GABA system. Another one that I really like is lavender. I just really like the smell of lavender. There have been some pretty interesting studies where just putting a little satchel of lavender next to your pillow at night can help you fall asleep faster, reduce awakenings at night. They've even done studies in nursing home patients where they nursing home patients, right, where instead of giving someone benzodiazepine, which definitely works on the GABA system to help knock them out and go to sleep, but there are some side effects where they can get dependent on it and you can wake up and fall and break your hip. So as we're trying to get the elderly folks off of the benzodiazepines, what can we do? We can give them a little of a lavender and it can help with some of the withdrawal symptoms and really with a lot less side effects, right? And so I thought that was very helpful. The thing about lavender, if you're going to use it for aromatherapy, you want to like the scent because if you don't like the scent, if it's a noxious scent to you, it's going to have that opposite effect. What I encourage people to think about sleep is when your brain waves slow down. And so if there's a stimulus, if there's something that's provoking you or triggering you, not to feel pleasant, not to feel calm, whether it be a noxious scent or sometimes it's a thought that you have that can keep you from falling asleep. And that could be a reason why these substances don't work, right? Lemon balm. I also like the I also like the smell and scent of lemon balm. It's a plant in the mint family. It can be a little bit pungent, I think, if you have it in an essential oil. But yeah, one study demonstrated a combination of valerian root and lemon balm, and then in menopausal women, and actually did show an improvement in their sleep. So again, if you like the smell of lemon balm, or if you don't like the smell, you can find it in even a tincture or even a supplement and see if that helps you sleep. The thing about a lot of these herbs is they potentially have a lot less side effects as compared to sleeping pills. We're sort of a day and an age now where doctors and healthcare providers are really trying to avoid giving chronic pills to folks because there are some concerns for memory issues, dependency. And I really want to encourage you to, if you are on a medication chronically to help you improve your sleep, see if you really need it. Try a little holiday of it because it may be more of a dependency than actually what the pill is really doing in and of itself. And if you have insomnia, behavioral approaches are actually really beneficial. So, cognitive behavioral therapy. If you have difficulty sleeping, maybe from time to time, maybe there's a big test or coming up or a big presentation, these things, these supplements, pills and potions may help. But like I said, if your brain is so active, right? Sleep happens when your brain moves so down. If you're constantly worried, if you have a lot of anxiety and that anxiety is getting worse and worse because you can't sleep, these pills may not be that beneficial. So it's really helpful to take a look at the thoughts that you're having. Yeah. With that said, there's other ones that have been studied. Chamomile, passion flower are some. I really like the taste of passion flower tea. Kava kava. This one's interesting. If you haven't looked up the history of kava, I encourage you to do so. It's used in I think Samoa, right? There are certain islands in the Pacific where kava has been used more ceremonially. There has been a concern for liver toxicity with kava, so that's something to be concerned about if you have liver conditions. But yes, kava has been used for a while as like a ceremonial type drink and to help with anxiety. More popular now is L-theanine, and this is a non-protein amino acid that can have some calming effects. And it also has been shown to help with some anxiety as well. So things that can help with anxiety can potentially also help with sleep, right? So a lot of times we can't fall asleep because we're anxious. So there have been some supplements. There's a supplement that I like to recommend to my patients. It's called Sleep by Doctor Formulated, and it's a mix of lemon balm, L-theanine, I think passion flower as well. So something to consider if it works good. Um, it, However, if you try it and it doesn't work, it could be because you have an underlying anxiety or a lot of stress that's not controlled, or even an underlying medical sleep condition such as obstructive sleep apnea. That is a big reason why patients have a hard time staying asleep. So, sort of in conclusion, I'll just briefly mention the potions and herbs that I talked about. So, melatonin, magnesium, valerian hops, lavender, lemon balm, chamomile, passion flower, kava, L-theanine, and those are a few. If there's any others that you find out to be helpful or not helpful or have some side effects, go ahead and let us know and comment below. So, hope you found this video helpful. I do have a upcoming talk through the Women's Sleep Summit, March 4 and 5. If you haven't registered, I'll go ahead and put that in the link below. I'll be talking a little bit more about some of these supplements. Have a great rest of your day. And as always, rest well. Bye now.